the clients that come to me feel really kind of like dejected and just like kind of like hopeless at that point. They're like, "Oh, I've been through all these providers. Like, when am I going to be able to get this addressed?"
Welcome to StrongHER Voices, the podcast for women stepping into their StrongHER era. Whether you're navigating perimenopause, menopause, or simply the next powerful chapter of your life, you're in the right place. I'm your host, Ashley Basilio, certified menopause health coach, fitness professional, and lifelong learner. Here we replace confusion with clarity, isolation with community, and overwhelm with simple, sustainable steps forward. In each episode, we talk honestly about the changes happening in our bodies and lives, explore strategies to help you feel energized and confident, and hear from experts and real women walking this journey beside you. Because this isn't the end of anything, it's the beginning of becoming stronger. Let's dive in. Hi, friends, and welcome to StrongHER Voices. I'm so glad you're here. Today's guest is Brianna Dawson, a board-certified psychiatric nurse practitioner and the founder of Behavioral Wellness for Women, a boutique practice specializing in reproductive psychiatry. Brianna supports women across the reproductive lifespan, from pregnancy and postpartum mental health to PMDD, premenstrual dysphoric disorder, to perimenopause. And what I really appreciate about her work is how hormone-informed and integrative her approach is. She blends evidence-based medication management with lifestyle support and lab-guided care so women can feel stable, clear, and like themselves again during hormonal transitions. And I just want to say this before we dive in. If you are feeling more anxious or irritable, even flat, overwhelmed, foggy, and you keep wondering, is this just stress? Is it aging? Or is something actually shifting in my body? Is something wrong with me? Then this conversation is going to bring you so much clarity. Brianna, I'm really, really grateful that you're here, and welcome to the show.
Thank you. Yeah. Thank you so much for having me. I appreciate it.
My pleasure. It's an honor to have you. So, Brianna, let's just get started here with the listeners. Can you share a little bit about your background and what led you to specialize in reproductive psychiatry and women's mental health overall?
Yeah, of course. So my background is like inpatient psychiatry, psychiatric hospital. And I decided a couple years into that to become a psychiatric nurse practitioner. And when I was applying for my first job, it just happened to be a women's center in the area. And so it was really like kind of fell into my lap. And I just loved it, and got like some more specialized training in the area of like women's mental health. I started with medication management, and then it kind of evolved from there with my interest in hormones and integrative psychiatry.
I'm really glad that it fell into your lap like that, because it seems as you were made to do this work. So you work with women across many hormonal transitions, and I love how you state it that way. Pregnancy, postpartum, and perimenopause. I think probably most of the listeners in StrongHER Voices right now are in that perimenopause, menopause phase. So what stands out to you about midlife compared to those other stages?
Yeah, in midlife, I noticed that when people come to me, they're like, a lot of them, not all of them, have never seen a therapist, have never been on any medication for mental health. So that, they've had great lives, and they're like, I have no idea why I feel so crappy. I'm waking up in the middle of the night. I'm having like brain fog, trouble with attention and focus, issues with mental clarity and word finding. So that's what I find is like really different with women who come to me in that specific time period of perimenopause or midlife stage.
I can relate to that.
Yeah.
That's where I personally am right now. Finding words is hard. I feel like if all the times in my life where I was going to start a podcast, this is the worst time. I'm like downloading apps left and right on how to speak more clearly. So I can relate to all that. And so when women come to you and they're saying those, like they just don't feel like themselves anymore. They feel like something's taking over their body. Like, what are you seeing that's happening beneath the surface?
Yeah, beneath the surface, a lot of times there's fluctuating estrogen levels, declining progesterone levels, which all impact mental health, obviously. Estrogen has an impact on serotonin, which is like the neurotransmitter that makes us feel calm and happy. So a lot of times there's a lot of increased anxiety. So those varying fluctuation in hormones are really what tends to be going on, even though it's sometimes even hard to see on lab testing what's really going on.
Do you think there are any misconceptions that women have about psychiatric support in midlife?
Yeah, yeah. I think there's still a lot of stigma around mental health and psychiatric medication, and it's something that I think is evolving, which is good. But I find that some people are like, I don't want to take this, or I'll try it, but I don't want to take
Hmm.
it long term. I don't know what like the long term effects are going to be. So I think there's just like a lot of shame around it. And the idea of like hormones, it's like it's naturally occurring in the body, and so it's like kind of a little bit more accepted, more widely accepted for sure.
Do you ever come across any of your clients that have been dismissed by their providers during perimenopause? Like I know for me, for example, I suffered with sleep issues. I suffered with depression a lot through my 40s. And I have been to multiple therapists, multiple sleep doctors, multiple GYNs, even like gastro doctors. And not one of them ever mentioned to me that any of my symptoms, I'm not saying all of them, but any of them could be related to perimenopause. And I'm wondering if by the time your clients get to you, if they're have experienced the same thing or have ever been dismissed by their providers, and like what's the emotional impact of that?
Yeah, definitely, definitely, definitely. A lot of times it's not even brought up by the provider, and like when the client brings it up to their providers, they feel dismissed. They don't feel heard. They don't feel like their concerns are adequately addressed. Providers aren't provided, like they won't test their labs when they want to get hormone testing. And I feel like the clients that come to me feel really kind of like dejected and just like kind of like hopeless at that point. They're like, "Ugh, I've been through all these providers. Like, when am I going to be able to get this addressed?"
I can see that maybe some clients might come to you thinking that it's in their head, or they're just going crazy, and I can imagine that the work you do, probably you help them understand what's going on with them hormonally.
Exactly. And just like being able to explain what's going on during this period is just so validating for people, and it's really relieving because like, okay, she understands what's going on, and there's options out there to help you. You don't have to just kind of like just because you're in this phase just deal with it. This is just how it's going to be.
Are there any classic phrases or things that you hear women say that make you think that hormones may be involved when they may not come to you and have any notion that it could be a hormonal transition? If our listeners are thinking, oh, that's the way I feel, maybe this is hormonal, maybe it's not in my head. Like, what keys you off to that?
Definitely the brain fog, the trouble with word finding, the night sweats, the waking up in the middle of the night,
Mm.
multiple times a night, restlessness, and then just the anxiety that seems to come out of nowhere, or the low mood or depressed mood that they are like, I don't even know why I feel this way. There's nothing wrong, like like everything's great, and they can't really pinpoint what's causing these symptoms. And then there was something else that I was going to mention. Oh, the other thing that I was going to mention was the client wouldn't know, but I would know, like if they're when I ask them, how are your cycles? Like, are they
Mm.
like are they longer in between? Like, are they closer together? Has the bleeding increased or decreased? Different things like that can help pinpoint, like, okay, this is something that's more hormonally driven.
That's excellent, right? Yeah, that's really good, because that's the sort of signal of when you enter perimenopause. Your your cycle gets all whacked out. So that's a great thing. That's pretty black and white. People can recognize
Right.
when they're in perimenopause. I know that's what happened to me. I remember going to, it was like 3 GYNs ago, but she could barely walk into the office before I said to her, I know I'm not pregnant, but I've missed a few periods. And she just laughed and was like, "Oh, that's perimenopause." And I'm like, no, I'm telling you, I know I'm not pregnant. Like, forget perimenopause. That's for old people, right? Why is this happening to me? And it just took me like months to let that sink in. And yeah, it was all related to my period. So it's a great that you're looking at the whole woman, the whole experience, physical and emotional and mental. When you're talking to your clients and talking to them about their symptoms and what they're reporting and how they're feeling and what they're thinking, are there certain red flags that suggest that their symptoms may be hormone-driven versus a psychiatric disorder? How do you tease that out?
Yeah, it's a lot of interrogation. I don't want to say interrogation, but
Yeah.
asking a lot of detailed questions, and through that I can kind of identify patterns. A lot of women who, like, if they're on medication, for example, for like a mental health condition, that might incline me to make a medication adjustment, but that doesn't mean I'm not looking at the whole picture. So I'm asking them questions about their menstrual cycle, like if they've had pregnancies and births before, how they responded to like those hormone shifts, how their pregnancy was, how their mental health was during their pregnancy, how their mental health was in the postpartum. So like just looking at all phases of the lifespan women and how they responded to the hormone shifts can also kind of clue me in on if it's might be something hormonally at this point in time. If they've never been on medication before for psychiatric conditions, then it's like, okay, this could be related to your cycle. Another thing is like PMDD symptoms. So if you're having irritability or increased anxiety right before your cycle, and then it kind of just stops when you start the bleed, things like that. If you have a history of that, then it's like, okay, you're more sensitive to fluctuations in hormones. So this could be like a hormone shift, and you're responding to that emotionally.
Okay, so are you saying there's a connection, or maybe in some cases, not all, I don't know, but there's a connection to how a woman experienced their puberty and their pregnancy and their postpartum to how they might experience perimenopause?
Definitely. Definitely.
Really?
Yeah, because some women have like increased sensitivity to the hormones. That's what premenstrual dysphoric disorder is, right? It's like
Okay.
a sensitivity to the change in the hormones, right, leading up to your cycle. And so if you have a sensitivity at that point, or even like other points in the hormonal transition during pregnancy, postpartum, then that indicates like there's a high chance you're going to be have like increased sensitivity to these hormone fluctuations in the perimenopause period for sure.
Okay, yeah, so getting a bit of history, and right. So that's another thing our listeners could actually, go back and do a little mental inventory about how they felt during these previous huge hormonal transitions in life, and if there's some continuity there, that can be really insightful.
Definitely.
How does a woman know the difference between like a situational anxiety and a hormone amplified anxiety?
Yeah. So situational would be, there was this like I had this big project at work, and I was like so anxious leading up to it, and I like couldn't sleep, and I was getting into arguments with my husband, things like that. So it's very, you can pinpoint the exact trigger there. When it's more hormonal, it's like I don't know why I feel this way. Like I'm so anxious, I'm so irritable, and it's like I can't
Mm,
even control it. It might coincide with your cycle or it might not, because there's hormone fluctuations in perimenopause. They're not predictable. So with the estrogen levels going up and down, it's not predictable. And so that's when the anxiety, the irritability, and sleep get disrupted and feel more out of control.
I think what you said there is really important. Like something that you can pinpoint that's maybe a specific event or a specific person or a specific scenario that you're worrying about versus I don't even know what I'm worried about. I'm just worried all the time.
Right.
Or I'm worried about things that I didn't used to be worried about.
Yeah. And
Okay.
exactly. And it could be like physical, even like, oh my God, I feel so restless. My mind's racing, but
Mm.
I'm having heart palpitations. And I have no idea what's causing this. Like, things are great at home, things are great with work, things are balanced. And I'm just not, I don't feel right in my body.
Okay. So let's say you do have a client that comes to you and says exactly that, right? Now,
Okay.
like you have this menu of options that you can offer. And you need to think about like talk therapy or medication or hormone replacement therapy or some kind of combination. How do you help women sort out what you recommend and what they're willing to do?
Yeah. So I'd say in terms of therapy, like I think everyone should be in therapy. Like I think therapy. Yeah. Yeah, therapy can be so helpful. So in terms of like supportive therapy, or even like someone that kind of focuses on this period of life, like perimenopause, menopause, seeing someone to help you work through like when you're feeling anxious, like grounding techniques, different tools that you can implement to help you calm down and get restful sleep, maybe developing a sleep routine, things like that I think are invaluable. While most of my clients do come from therapists, I'm always recommending therapists to my clients. So that's kind of like a baseline thing that I think should be there. Not to say you have to work with me, but I think it's a really good tool to have. And then in terms of, where I start in terms of like medication or labs or hormone replacement, when it comes to, lab work, I tend to say like, when was the last time you had your lab work done? If it was recent, then I'll take a look at their labs. If it wasn't recent, then I'm like, well, let's get baseline labs. Let's look at your hormones. Let's look at your overall health, your metabolic health, and even like nutrient levels like vitamin B, vitamin D, zinc, magnesium, iron, because all of those things can have an impact on how neurotransmitters work, like serotonin that helps calm anxiety, brain fog, energy, fatigue, all of those micronutrients impact those things. So I'll say let's get a set of lab work, including your hormones, and then we might, depending on kind of where they're at with their mood and anxiety, like if it's really distressing and debilitating to them, I'm going to start them on some type of psychotropic medication to help ease those symptoms, because I don't believe that you should have to suffer,
Mm-hmm.
while we're trying to figure things out if it's to that point. So I might start them on a low dose of something to take the edge off and have them get their lab work done. And after that, I'll review their lab work and we'll get a look at what's going on in terms of like hormone levels and like other things kind of in the background, and we'll kind of go from there. Yeah, but there's some people who don't want to get their labs done. So
Yeah.
it might just be straight psych medications, which is fine
Mm.
too. But the people who like kind of want a deeper dive into their overall health will go and dive into the labs first and go from there.
Do you see any trends with, you mentioned a lot of things that can be tested in labs with the vitamins, hormone levels, all that kind of stuff. Do you see any sort of trends that stick out where women in perimenopause are, a good portion of them are showing low level of this or high level of that you can help us understand maybe how we could interpret our labs?
Yeah, so I mean, in terms of B vitamins, so at first I want to say that in complement like traditional medicine, that you might have like vitamin B, vitamin D, and say iron levels, right? That are reviewed by like your, traditional conventional medicine PCP, and they may say everything looks great. But I'm looking at those numbers from like a functional medicine perspective, so like optimizing them for your mental health. So I'll say that, like, just so you know, it varies depending on what provider. Like if you're in traditional medicine, they'll go by kind of like the numbers on the lab sheet, like the lab range. But I'll be going off of like functional medicine levels to like make sure the levels are optimized for your mental health. I'll say like one thing I'll throw out there, for like vitamin D, for example, say it's like 30, it might show as normal, but in like functional medicine, we're trying to optimize to like 60 or 70 to really help with mood. It helps with depressive symptoms and anxiety, and that can really impact that.
That's great. And I actually had a guest who was a nurse practitioner a couple months ago, and she touched on the same thing. She talked about your labs and the normal range and how that normal range was derived and who was the population and all this kind of stuff. And having a provider like yourself to look at that and say, okay, this may all be normal, but where is optimal? And how can we move in that normal range to make a big impact in how you feel? And that's really one of the benefits of seeing a provider like yourself, to take a deeper look, especially when hormones are at play. Like, I mean, I've had blood work done every year for forever, but I feel like I have to ask for special things. Like I have to ask, could you check my thyroid, or could you check
Yeah.
these vitamin levels? It doesn't,
Yeah.
and the only reason I know to ask stuff like that is to follow you on Instagram or read an article somewhere. Like I wouldn't know. Women don't know to
Yeah.
ask this stuff, right? I love that you pointed out the difference between a normal range and and optimizing. That's really great.
Yeah, and I wanted to add something else kind of on the lab front, and specifically in like perimenopause, that, labs aren't diagnostic of perimenopause. So perimenopause is something that's more like symptom driven in treatment. So we're going off of like, we could be going off of your cycles, the length increasing, decreasing, or being variable. And then we're also going off of what you're saying you're experiencing. So it's mostly driven off of that. So like, you can't diagnose perimenopause off of lab panel because when we're getting your labs, right, your blood work, it's a period in time with the hormone. So that's like what your level was in that period of time, but it's always variable. Something that in some people can be really helpful is if your estrogen levels are super high or super low, that can be indicative, give us some information about what's going on. And then progesterone levels, if they're particularly low. And then I also get like testosterone levels. And so like seeing like the ratio between the hormones and things like that can help. If you have really low testosterone, wow, that might be impacting your memory, attention and focus, energy levels, mood.
Yeah, and I've heard that as well too. And I have an engineering background and I love data, so I just think the more data, the better. Although not
Yeah.
all data was created equally either. Some is more important than others. So I have always heard that perimenopause cannot be diagnosed by a blood test. And so I'm glad you touched on that again. Even though perimenopause is not diagnosed by a blood test, the levels of those major three hormones, estrogen, progesterone, testosterone, are tested, and you get the value for that point in time. Are they meaningless, or can they tell you anything?
Yeah, so they're not meaningless. I guess my point to bring that up was that, like, say, like, everything looks normal, right? Like, all the
Hmm.
levels look normal for that period in time. That doesn't mean you're not in perimenopause.
Hmm.
But if say your estrogen's really low or your testosterone's really low, that's valuable information,
It
right?
is.
Yeah. Yeah, but
Okay.
just because everything is like in normal range doesn't mean like you're not in perimenopause, because that was for that point in time. It could be dipping, like it still could be variable with the estrogen levels, and that's might be what's causing like the anxiety, irritability, trouble with sleeping, things like that.
Gotcha. Okay, good. Great clarification there. Yeah, thank you. What sort of things would you step away from the prescription side of things with hormone therapy or psychiatric medication and look at the non-medication support that you provide? What are some things that you recommend that women do who are in this perimenopause phase and feeling all the feels?
Yeah, something that I'm really big on is movement, resistance training, even going on walks, doing some stretching. I find that a lot of times the women I see are really busy, they're working, they're moms, so they have a family to take care of, and they don't have a lot of time. So sometimes that's really challenging. But the movement piece, they've seen it. Like my clients know when they move their bodies, they feel instantly better. Like when they do it, and it can help with sleep. Really helps with anxiety and irritability as well. So getting that movement in is something I would counsel on a lot. And then I do refer to like a nutritionist when appropriate, but really encouraging like protein and fiber intake to help with like fatigue, mood, energy, and even like bowel regularity. All
Mhm. What do you tell your clients about alcohol and caffeine?
Yeah. So in terms of alcohol, I tend to encourage them to avoid it. And then with caffeine, yeah, it can really contribute to anxiety in clients from what I see. But the clients who do use alcohol and marijuana, or not marijuana. Well, some of my clients use marijuana as well.
Mhm.
Alcohol, caffeine, any substances, I encourage them to just like, use it in moderation.
I used to drink a lot, and I'm 6.5 years sober.
Wow.
And I've never said that on a podcast before, so thank you for making me feel safe enough to say that, Brianna. Um, Someday I wanna do a podcast about it, but still have some feelings. And I'm very thankful that I gave that up when I did, because I gave it up, just about 5 or 6 months before the pandemic, and I know that my life would have gotten a lot worse, being homebound during the pandemic if I had kept up that habit. And I'm also grateful that I gave it up before perimenopause, because perimenopause in some respects has been really hard on me. And I don't know if I would have felt like using alcohol as a crutch, but I do know that it would have made my symptoms a lot worse. And although I know giving up alcohol is not maybe for everyone, well, I kind of think everyone should do it, but I know not everyone's willing to do it, or I know not everyone has a problem with it. But I tell my clients the same. So I was really happy to hear that someone like yourself and your background and education and experience, agrees that it's best to minimize that that fact.
Yeah, it can really impact like your sleep rhythms. It can affect, you'll definitely have nighttime waking with alcohol. And then it really does, I find in my clients, cause like anxiety.
Mm-hmm.
Um, so yeah, and even sometimes depressive symptoms because it's a sedative. Yeah.
Right. Right. Yeah. It's a real downer.
Yeah. But with the caffeine, it's harder. It's a little harder with the caffeine with people, I
It's a
think.
little harder with the caffeine.
Yeah. 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 Yeah.
Right. Yeah. Yeah, agree. I do try to tell women who are having problems with sleeping to avoid caffeine after 1 p.m. if possible. I just think the more space you put in between it and when you're going to bed at night is it could help you,
Right.
for the
Yeah.
best. Yeah. But
Yeah.
I know there's some women listening out there who are like, you can take everything from me, but you're not taking my coffee.
I know. Yeah. Especially the moms. Yeah. Or get to sleep at night because of their babies and all that.
Yeah, exactly. It's like a warm hug. I understand that. Yeah. Can you explain what like an initial visit or psychiatric visit to you would look like? What would it be and what could a woman expect?
Yeah, I just wanted to kind of start with like kind of the process to like, to work with me. So on my website, you can just go to the contact page and there's a calendar there. So I offer a free 15-minute phone consultation to just see what's going on with you, see if it's you can we both see if it's a good fit and kind of present to you kind of like my workflow and my treatment options that I provide. And then if you think it's a good fit, we go ahead and schedule the eval. So the psych eval is 90 minutes long, and you'll once you book the appointment, you'll get like a all this paperwork to complete so I can review it before we meet, which is super helpful. And then in that assessment, I'm really going through kind of like childhood on of like mental health symptoms, and then from there weaving in some of the hormone stuff, so how your cycle was, pregnancies, postpartum, all of that, and then to present time. And I'm going to tailor that psych eval based on what your concern is, right? And so I one thing I want to be mindful of is I don't want to like, for someone who say they don't have any mental health history and they're like, I don't feel right, I think I'm in perimenopause, I don't want them to be afraid of like the term psych eval.
Mhm.
I think it is really important to get a mental health history on everyone. And like, given, my trade of being a psychiatric nurse practitioner, I'm always taking that into account. And I think it's so important. But we'll definitely tailor, the evaluation to what's going on with you and your symptoms. But I will be getting, a full history of mental health. And I think that's really important. At the end of the eval, I'll then kind of present the treatment plan. These are the medications or hormones or supplements that I'd recommend for this. And then we'll kind of go through what I think it's going to help with, any potential things to look out for in terms of side effects, just so know what's going on. If you experience something, you're not surprised. And then if you agree with the treatment plan, I'll go ahead and like prescribe. And then we'd likely follow up within a month to see kind of where things are at in terms of mood, energy, anxiety, sleep, all of that.
That sounds really comprehensive. Do you do lab work as part of that eval as well?
Yeah, that's a good question.
Okay.
So when we meet in the 15-minute phone call, depending on kind of what's going on, I might order the labs then, like once you book the eval.
Okay.
And then we can then review it during the eval, which is super helpful, like the results. But in some cases, might do the eval first, depending on what's going on, and then order the blood work at the end of that appointment and follow up in a month and then review the lab work.
Okay.
So the lab work, if you're cycling, then we're going to need to get it during a certain time period, days
Mm.
19 to 22 of your cycle. So that kind of all plays a role in kind of the timing of the appointments and the follow-ups and when you can get your labs done.
Okay. Interesting. I've never heard that before. Now, as a psychiatric nurse practitioner, are you actually, and I think the answer is yes, but I just want to make sure, are you actually prescribing hormone therapy or just the psychiatric medications?
Yeah, so with my specialization in reproductive psychiatry and the training I have, I do prescribe hormone replacement therapy
Okay.
because it's affecting your mental health rate. So the indication is anxiety, trouble with sleep, irritability, brain fog, trouble with attention and focus. All of those have psychiatric indications. So certainly prescribing hormone replacement therapy for women.
Okay. I know when I first started using hormone replacement therapy, I was put on patch, and it ended up not working for me because I developed an allergic reaction to it, and then it would like fall off and stuff. And I know there were different doses, and my provider started me at the middle. So I just thought of this question. Should have asked you earlier, but let's say a woman's coming to you, and she's already on HRT. Are there any situations where you would play around with the dosage of the HRT? When I asked my provider, well, after a time, I switched to the gel and a different provider. And I said, I'm feeling pretty good on this, but could I feel even better if I up the dose? And she said, as long as your hot flashes are under control, I'm not upping the dose. And I was just wondering if you have ever been asked that question, or if you ever mess around with the dosage.
Yeah, yeah. So I haven't been asked that question in terms of HRT, but I have when it came to psych meds. Like, I feel great. Could I feel even better? And
Mm,
so, yeah, I would just like manage like kind of like expectations in that are we chasing like a feeling or something like that? Does that make sense? So just
yes.
like balancing things out. But certainly, like if someone came to me on HRT, and they had several symptoms that didn't feel quite managed, like we're adjusting the medication.
Okay.
Yeah.
Okay. Yeah. So if they're still struggling with some of the same symptoms, it might be a cause for adjusting the medication. But if it's like, I feel good, but how good can you make me feel?
Yeah.
That's a different question,
Yeah,
right?
it's a balance, yeah. But like if you're
Oh,
having, say your hot flashes are under control, but you're having like brain fog and you're having anxiety and trouble sleeping, like then it's like, okay, let's make an adjustment.
right. Okay. Great. That's great clarification. Oh, thanks for that. If someone's hearing you today and saying, I feel anxious and irritable and unfocused and fragile, and I'm just worried all the time that something's wrong with me, and I don't know where to start, what are some steps that she could take today?
Yeah. I would say seeing a provider like myself that specializes in reproductive psychiatry, they could see their GYN. They could seek out therapy, but I think like I said, I'm always recommending therapy, but if it's something, that's kind of like out of nowhere, you don't have any mental health history, it might be best to either go like the reproductive psychiatry provider or a GYN who specializes in that area and we can like do an assessment or evaluation and figure out how to help you feel better.
And do you have a message for women out there who might feel embarrassed to ask for help because they think they should be able to handle it and others have it worse?
Oh my God, I hear that all the time.
Right? Yeah.
Yeah, like you deserve to feel good. You deserve to feel better. Don't compare yourself to others, because everyone's going through something different, and there's lots of factors that contribute to how people, to those things of how people are doing. But you deserve to feel good, and so, yeah, ask for help because it can help your day to day life, your
Hmm.
work, your relationships, and your just overall quality of life.
Well said. Well said. Any last bit of takeaway that you want our listeners to leave with after hearing this conversation, Brianna?
No, I would say definitely asking for help. Asking for help, no question is too small, no issue is too small. And I just wanted to share about like my women's hormone lab guide.
Yeah,
It's
what is
my
that?
website. It's it has the different labs values and tells you like what it's related to in terms of mood or other symptoms, and helps you kind of like see patterns and like, oh, I might be experiencing this. Could be related to my testosterone level or things like that. So it's a free guide on my website. And then I do have the Women's Hormone Clarity panel, which is a lab panel. And it comes with doing the labs, like labs are included, and the assessment, the 50-minute assessment with me. And then from there, we kind of talk through treatment options for care.
And where do you practice, Brianna?
So I'm completely virtual in Pennsylvania, New Jersey, and Delaware. I do have an in-person office in Fort Washington, PA.
Okay, great. I've heard you talk about your perimenopause focused psychiatric care program waitlist. Can you tell us what that's about?
Yeah, so it's a comprehensive program. So it's not out yet. I'm still working on the behind the scenes, but it would start with it includes that assessment, the labs to start. And then there's biweekly emails that give you tons of information about what you're experiencing in perimenopause, from like nutrition to exercise to the different hormones, kind of breaking everything down. So you kind of have that support along the way. So it kind of answers your questions that you might not even been thinking about or might have been thinking about kind of along the way. You're getting that information between visits.
Is that a group program or a individual one-on-one?
It's individual.
Okay, okay.
Yeah, so it comes with, so you're getting like the biweekly emails, and then you're getting, depending on kind of what tier in the program you're in, certain number of appointments with me as
Ooh,
well.
neat. When do you anticipate launching that?
I think like probably closer to the summer because I'm working on like a different program not related to on like pregnancy and postpartum. So I think I'm going to
Mm.
launch that one first. Similar format, and then I just wanted to add that in the program it also like labs come with it as well, like in the package that you get. So.
Okay, so that sounds like a really amazing program. And so where can women find out about that program when it launches? Is this going to be on your website?
Yeah, you can find it on my website. But if you do like the I think it's a women's hormone clarity panel, then and we do the assessment and the labs, and you become a client, just kind of like doing individual appointments, then you'll be getting the information about the program internally, and there'll be like discounts for my clients who are like already working with me.
Okay, perfect. And your website, just so everyone hears this, is behavioralwellnessforwomen.com.
Yes.
Okay, and I'm going to put that in the show notes as well as a link to her free women's lab guide. So everything you need will be in the show notes on how you can contact Brianna and work with her, get her free guide, and find out about her upcoming programs. This was fabulous, Brianna. Thank you so much for this conversation.
Of course.
Yeah, I really appreciate you. I appreciate how clearly you explained something that so many women are living through. And it's just really validating to hear that these symptoms aren't a character flaw. They're not a personal failure. We're not broken and falling apart. And I say we there, but they're a very real and treatable response to hormonal change. And your patients are so lucky to work with a provider like you. And if you've got listeners out there who don't live in the Pennsylvania, you said Pennsylvania and Delaware?
Pennsylvania. I'm like, wait, I was Pennsylvania, New Jersey, Delaware, and Florida.
Okay. And if you're out there listening and you don't live in Pennsylvania, Delaware, New Jersey, or Florida, to be able to work with Brianna one-on-one, please find someone just like Brianna who will make you feel seen, because I want you to remember that you don't have to push through in silence, and support that of the type that Brianna provides can make things feel really lighter sooner than you think. And so I'm going to, like I said, put her information in the show notes. She's generously sharing a free women's lab guide to help you understand labs that can influence your mood and your focus and your energy and all of your emotional regulation during hormonal transitions. And you can find out more about her services. And she's got a great blog and all of the good things on her website, behavioralwellnessforwomen.com. If you are listening today and you know of a friend who looks just fine on the outside, but you know she's struggling inside, please share this episode with her. Please share Brianna's website with her, because you might be giving that woman a permission slip that she didn't know she needed. And like Brianna said in the message she left us with, seek help, reach out. There is help. You can feel better and you deserve to feel better. So Brianna, thank you again for your expertise, your compassion, all the work you're doing for women. I'm so proud to have you on this show, and I'm really thankful for you and your message.
Thank you.
Thank you so much for listening to StrongHER Voices. If today's episode supported you, inspired you, or made you feel seen, I would love for you to subscribe and leave a quick review. It helps more women in their StrongHER era find this show, and it truly means the world to me. If you're craving more support, accountability, and connection, come join our vibrant community at getfitwithashley.com/stronger. Inside StrongHER Together, you'll find daily encouragement, expert coaching, education, challenges, and a sisterhood of women committed to growing stronger in every way. Use code VOICES for $25 off your membership. And don't forget to let me know where you're listening from. I love adding pins to my world map of StrongHER listeners. And just a reminder, StrongHER Voices is for educational purposes only and is not medical advice. Always consult your healthcare provider about your personal health needs. Until next time, remember, you're not in a pause. You're in your power.